And so some of the unknowns and future opportunities, these early phase studies are sort of where we have clear data. These red boxes are where we really don't have clear data. And whether there's a role for people who have a tumor that's in a really difficult location and surgery, even by the amazing neurosurgeons at UCSF, is risky. Is there a place for these drugs even before you have surgery? What if it's something that's incidentally discovered? Does that make sense to start somebody on a drug even before doing a surgery in and of itself? And how can we actually find that IDH mutation if it's not necessarily in the tumor and having to go through brain surgery? Is there a blood sample or some other MRI characteristic that we can non-invasively find this IDH mutation without having to do a brain surgery? What about people who are like a month out from brain surgery, or people who are 20 years out from their first brain surgery? How are those people going to do with tumors? What about those who have grade 3 tumors, or those who have enhancing disease, or those who've had radiation and chemotherapy? I mean, the FDA has allowed us to get some of these answers, but again, as we figure out the timing and what this means for you as you come here and talk to your neuro-oncologist about this medication, again, there's a lot that we don't know. What we do seem to receive from feedback from the insurance companies is using it in combination with something like temozolomide or other chemotherapies is not something that they're going to be approving right now. We don't have any safety information about whether that's safe. And so that's something we're going to need to do research on and understand better. But again, treatment at recurrence, or maybe even for people who've had radiation and chemotherapy and have had a really good response and everything is stable, do we put all those people on Voranigo as well? What about people who've been on Tibsovo or ivosidenib for years and years and years with stable disease? Do we switch those people all to vorasidenib? A lot of unknowns. We'll learn more about this. And I think what's really important is we don't actually know that this drug is going to help people live longer, like actually increase the number of years that they're going to live. We're using this MRI essentially as the surrogate marker, but we don't actually know that this is going to extend people's lives. And it's going to take a long time for us to actually get that answer. Because of the design of being able to cross over from the placebo to the vorasidenib, it may be really hard to get those answers. So this is not a clinical trial where we've compared it to what we've known to always be helpful, radiation chemotherapy. That's not what this is. This is paving a new path, and it's really difficult to compare it to the historical prior paths. The company has still done a very good job of assessing quality of life, assessing quantitatively impact on seizures, and also cognitive outcomes. So patients who are on the Indigo are getting cognitive assessments to see if it seems to sort of stabilize cognition or maybe even improve cognition over time. So how that translates into you as an individual patient, if you're not on the Indigo study, I think we have a lot of questions to be answered, but again, a lot of resources at UCSF to help along those ways.